Welcome back to the Thom Hartmann Program. I'm Alex Lawson, filling in for Tom, down to my last half hour here with you all. So I'm going to try to take as many calls as possible. Joined in studio by Dr. America, who is going to take the calls with me, and we're going to go right to Penny in Kentucky. Penny, you're on the line.
Hi, I just wanted to make a quick comment regarding insurance. My husband is in a union, and in 2010, the membership voted to have 25 cents per hour taken out of their checks in order to have a separate fund for workers that were laid off to retain their insurance. And I just wanted to say that I'm so proud of our membership for voting this in so many years ago in order to keep the members that are unemployed covered with insurance. And I just get so discouraged that our society doesn't care about its people. And I just wanted to say that something really needs to be done, that we need to care about each other.
Penny, I think your story is so important, and thank you for sharing it. And that is solidarity. What that is solidarity. Yep. The workers are expressing solidarity in saying, you know what? If a worker loses their job, that doesn't mean that they should lose access to health care. Okay, and we all together, we don't know who might lose their jobs, but we're all going to pitch in through solidarity. Yeah. And that's a incredibly powerful story. And I want to let you respond any way you want.
And I really hope Senator Mitch McConnell heard that story and gets to hear it, because, to me, I think that what's happening in Kentucky is happening in a lot of different parts of the country where, everyday Americans are trying to figure out, how do we look out for each other? And, it's hard when there are stagnant wages, when, you're looking at a whole lot of costs go up, like, how are you going to afford rent? How are you going to afford groceries? How are you going to afford your kids' tuition? Like, all these different costs are racking up. But yet here we are, like the American people still wanting to know, how can we look out for each other? And to me, I think it's that, like that unselfishness, that selflessness is really what guys like Mitch McConnell need to, tap into, and really need to make that like a cornerstone of American healthcare policy. And I really appreciate hearing that story, just because to me, it's proof positive that, there's nothing wrong in America that Americans can't, get together and fix. And we need our leadership to just, hear us out, because I think our decency is much stronger than our leadership. And
if they're not going to get to hear us out, we need to defeat them and replace them. Yeah. Repeal and replace Mitch McConnell, for example. Yeah. The story is very powerful and important, and it also makes me mad. Yeah. It makes me mad at the same time, because why should losing your job mean you lose your health care? Right. What a nonsense non-system we have right now. Yeah. It's ridiculous, and we're the only ones who have this. Right. So, like, the idea that we can't do anything about it, we're the richest country in the world at the richest point in our history, and every other advanced economy has guaranteed health care as a right. We are the only ones. Right. Yeah. And, but we're leaving it up to the people to through solidarity. This is why we need to really show our leadership now. Yeah. While we oppose Trump care and the destruction of Medicaid and the raiding of Medicare, we also need to be fighting for what we want. Which is health care as a right for all Americans. Absolutely. Penny, thank you so much for calling. And, I hear I hear when you say that it's disappointing and people not caring for each other, but I'll tell you, the people do care for each other, like you, and the workers that you're talking about, and millions of Americans around this country, we really do take care of ourselves, and care for each other. And there's the numbers, like when they look at who gives charitable giving, it's actually the low end of the income spectrum that gives the largest portion of their income in charitable donations. The people are fine.
Right.
The undeserving billionaires on the top, the parasitic middlemen in the insurance industry, in the pharmaceutical industry, they're not fine.
Yeah.
And if we can't convince them, we have to just defeat them and replace them.
And I think the piece of advice that actually connects, Kate from California and Penny from Kentucky is that, both of them are kind of asking like the thing of like, well, what do we do about all of this? And I think it's what we've been watching everyday Americans do, and that is to show up at every town hall meeting. Your city council has a chance for, citizens to comment. If, we've seen the FCC website crash because everyday Americans are, writing in. I think that, when you're, given the microphone, or even when you're not given the microphone, to show up and to speak out, because I think that, when those voices are being heard. And this vote on well, I can't really call it a healthcare bill. It's a wealthcare bill in the House. It was not an easy vote because people were nervous about going home to angry Americans. And my advice is to keep up that heat.
And they should be nervous. And, it took them 3 times. It took the easiest part of all of the process is getting it through the House.
Right.
They should have been able to get it through the House. They failed, and then they failed again, and then they finally got it by 1 vote.
Right.
And that is because of our voices. So we do have to just keep raising our voices. Town halls, phone calls, office visits, everything. Tony in New Jersey, you're on the line.
How you doing, Alex? Nice job filling in for Tom this week.
Thank you, Tony.
I wanted to say about single-payer Medicare for all, I believe that the American people need it explained to them in plain English why it is a viable alternative to the way we do things now. What will it cost? How will it be paid for? And I really do believe if the American people understood what it is about, how it would work, there would be a groundswell of support that I think would eventually carry the day, and it would become our country's policy. Maybe it's the Democratic Party, maybe it's just the progressive wing of the party, but it's got to be explained to everybody in a way they understand it, and they would say, we need to do away with this insurance company-driven, big pharma-driven system, and we need to go to single-payer for all so everyone is covered.
Yeah.
Great point, Tony.
And, Tony, I think that the last part you said is actually the great starting point for how to help average Americans understand what they have to gain from single payer. And what that is that if you're an average American getting your health insurance through your work, take a good look at, pay stubs over the last several years, and you're going to see that a bigger and bigger chunk of your paycheck has been going to an insurance company that is not doing its part to make you healthier and healthier. And instead, what you'll probably also see in those pay stubs is that Medicare has not been eating a bigger and bigger chunk out of your paycheck, and it's been doing a fantastic job taking care of people. And so, like, when you look at who has been more responsible with, with like the average Americans, dime and dollar, it's Medicare and Medicaid, hands down. Hands down, you want to talk about who has got like the best bang for the buck in American healthcare, you've got to be looking at Medicare, Medicaid, and to me, I think that once you you have to understand that split where like who do you trust more with your dollar, the insurance companies or Medicare? And once you get past that, then you can really start to say, well, wouldn't it be great if all of us could have this?
And we often talk about expanding Medicare.
Yeah.
Because of that point, Tony. And I know not everyone really fully understands what Medicare is, but most people generally have a concept of it. And the people who are on Medicare love Medicare, and the people who are close to Medicare, have spent a lifetime already dealing with the bureaucratic nightmare that is the private insurance industry. Right. And they're just waiting, sometimes limping into getting their Medicare. And so we're talking about lowering the age that you can get Medicare and not stopping till we get down to zero, because it's a way for people to understand the concept. And at the root of it, though, if we can just let people know that, and I think part of the problem, Tony, is that it sounds like it's too good to be true.
Yeah.
But it's actually that what we have right now is so bad.
Right.
It's unbelievable.
Right.
So the truth is, what a Medicare for everybody system would be is everyone would be covered.
Right.
There's no like you're in, you're out. No, everyone, every single person is covered. They pay less and they get more.
Right.
That is what it is. It just removes the inefficiencies of the for-profit system. But Tony, you're exactly right. And I want to give you a little preview that Bernie Sanders is going to be releasing his Medicare for All bill soon, with the explicit goal of making this one a very comprehensive but understandable bill. And then he's going to really hit the road to explain the concept to people. So thank you so much for your call. Tony, I want to go to Ashley in Arizona. You are on the line.
Hi, Alex, Dr. America. It's great to talk to you guys. Can you hear me?
Yes. Thanks for calling, Ashley.
Perfect. Thanks so much. I just kind of wanted to go over this whole myth of the young American that somehow doesn't need health care. First of all, how do we stay healthy if we don't have health care? And, being a young, healthy woman, a lot of times with that comes, pregnancy and children. I'm sorry, are you there?
Uh-huh.
Yeah.
Yep.
Okay.
We're listening.
Yeah. So, along with that comes pregnancy and children, and, with that, maternity care, prenatal care, well baby visits, somehow that young people or privileged people are somehow immune to tripping and falling and breaking their wrist. Or, any working mother can tell you that with daycare comes sick kids. You have to take them to the doctor. So just this myth of the young, healthy person who doesn't need health care. I think it just tells you that the conversation's being driven by people who just don't have a fundamental understanding of the just basic healthcare needs of the regular, everyday American family.
Or, Ashley, you might be being too generous, because I actually believe that they know exactly what the needs are and they don't care, because they know they can profit by denying care, that the money is in denying care. And so as long as they can create a broken system, that the brokenness of the system is the feature, not the bug.
Right.
Because that's where the cash flows from. The myth of the, invulnerable youth is a serious myth, so much so that we allow now, I don't think Trump Care took aim at this because it was so wildly popular. We allow children to be covered by their parents' insurance until 26, because around 18, you're seeing there's huge, but I should let the pediatrician talk.
I think that, as a pediatrician, one of the, biggest accomplishments that I've seen in my own career, is that when I was in training and when I was in med school, the number of childhood diagnoses where the end of the chapter is a tragic, sad story of like this young person is not going to make it past their teenage years and they won't live to be a young adult. Then you fast forward 10 years of medical science and advances, and these are patients who are making it into their young adult years. They're having families of their own. And this is opportunity for us to learn in terms of medical science, but it's also an opportunity for our society to have, young Americans with us who weren't going to be with us when, just a little while ago. And it's just nuts that that we would want to like turn our backs on that progress, and to have patients like mine, fight their way through cancer, fight their way to getting an organ transplant, And then it's going to be an insurance company that comes around and says, yeah, sorry about that. No, that is just not who we are.
And we only have a minute left here, but I worked to push for Obamacare, and because I knew that marginal improvements still mean real people's lives, and I worked in clinics, and so expanding Medicaid, but also because I saw, and I was there, I was a health educator, I saw the concept that a person's life could be not cost effective, right? That there's literally decisions that are made by a faceless bureaucrat in a suit, and you're like, why do you get a say in this? But there's a third party who can reach in and say, no, your life, because this doctor is saying you need this, and this, I'm saying, no, it's not cost effective. That whole concept is completely wrong. And we should never allow us to go anywhere near. We should not only not be going backwards, we have to be going forwards and get rid of the insurance companies totally.
Yeah.
We're going to be taking a few more of your calls with Dr. America on the Thom Hartmann Program. I'm Alex Lawson filling in, and we're going to be right back.